And I would like to invite you to the talk from Dr. Takeuchi, telling story, really beautiful story from Vietnam about what we really did to overcome this difficulty. And actually, I would like to know, I would like to say that there's many things we want to come back to the normal, but there's something we want to keep it right now because COVID-19 really pushed the healthcare system um, to reach many advantages that we did not do in the past. Thank you very much. Please start your presentation, Dr. Takeuchi.
Thank you very much, Dr. Kui, for your kind introduction. Can you share can you see my screen?
Yes.
Okay. Again, I also like to thank the organizer for having given me this opportunity. And after all these excellent presenters, I feel very humble to make. But I feel that my presentation talking about actually the importance of advancing universal health coverage, especially because in time of COVID-19, would somewhat supplement the excellent presentation of the efforts as Dr. Nguyen described, and how hospital has been striving, leading these efforts, as well as some of the systemic and also issues like NCD just presented by Professor Cham for the US. So I will skip this epidemiological situation, as Dr. Nguyen already explained very much in detail, that to show that how Vietnam has been having COVID-19 under control. So some of the best practice lessons learned already. I would not repeat too much, but we have seen the very strong government leadership and the whole of society approach and early activation of all the strong public health response system. And then, lessons learned and the good preparedness for health emergency, public health emergency response system. And I also like to add, because I'm leading the team for health system and health promotion in WHO Vietnam, I like to emphasize the last point, kind of to supplement the long-term investment of the government of Vietnam to strengthen people's access to quality services, including financial protection and preventive system, which really, I guess, resonates with the points raised by Professor Chang. And then but still to show the whole picture of what WHO supports to the government for COVID response. So we cover all these areas for public health response and also prevention and preparation of the system in time for the possible wider community transmission. So we have a team working on the health security and the communicable disease led by my excellent colleague, Dr. Satoko Otsu, known by many, I think, other Japanese colleagues. And I'm in charge of another team for universal health coverage, health promotion, environmental health, and so on. So this is really has been a kind of joint effort, because our team has been really supporting area like patient pathways, and then engaging community and other like e-learning and for healthcare workers that I will describe a little bit in details later, and other kind of preventive and health promotion measures in association with COVID-19. So I would like to introduce the universal health coverage, which is overarching health goals for the UN Sustainable Development Goal. The definition is that all people have access to quality health care when they need, without suffering financial hardship. And this is really the time that COVID-19 kind of magnified the importance, because of UHC and the US investment in UHC in the peacetime, as clearly described in the country, in the example of the US, for example, that when you have like health inequity and an inequitable system and a not resilient system, that virus will get to these, areas that is vulnerable and fragmented. So Vietnam, government of Vietnam has been investing in health for a long time, but especially past few decades, they have been increasing the government health expenditure at the faster level than the level of GDP growth. And as it stands, currently we have this UHC indicator as defined by WHO and World Bank. It's ranking around 75 out of 100, especially good indicators in the traditional areas supported like MCH and communicable disease. And we have some more remaining areas to be improved, especially NCD. And then in this bar graph shows the increase of health insurance coverage. So this has been really tremendous increase in terms of social health insurance coverage. Now more than 90% of the whole population is covered, and all the public institutions and the health insurance system, and some private institutions started to join. So in addition to the government expenditure, and especially the emphasis on the providing sufficient budget and the preventive system, this is really the backbone that people have assurance for UHC in Vietnam. Then also government has even more ambitious goal for 2030 to improve healthy life expectancy and health insurance coverage of over 95%, while further reducing out-of-pocket expenditure. And all the commune health centers should be able to manage, provide MCD management services. And immunization coverage is already quite high, more than 90%, but we want to have it more than over 95%. And then even a better control of HIV and TB and elimination of malaria and so on. So these are the UHC goals in Vietnam, and then Vietnam has been really steadily progressing towards this goal. So even before COVID, our office has been supporting what is called primary healthcare reform. And I think this is really a great story to supplement how the leading hospital like the Lung Hospital has been displaying that highest level of care with all measures to respond to COVID-19. But just going back to the history, around 1990s, when the Vietnam introduced Momoe and moved to the socialist market economy and associated with health sector reform, public health facilities started introducing user fee system. And in the last 2 decades, there's also another policy on hospital autonomy. So some public hospitals are required to be financial independent, either partially or fully. So this kind of triggered that hospital need to have the patients for their maintaining their revenue, and also as economy grew, people's consumers' perception for quality of care changed. So it triggered hospital overcrowding, as we call it. So if you look, this is the service delivery model in green triangle, which should be, and all the precious high-level healthcare and resources should be kept for the most severe condition, of course, the central provincial level hospital, but actual people's healthcare seeking behavior become like the opposite the opposite triangle shape. So this has really pressured the hospital sector, also kind of yielded the underutilization of district primary healthcare services. And in Vietnam, we call the district and commune level is the backbone of grassroots system. So the recent national policy in resolution 20, the government made it clear that strengthening the grassroots system and have people back to the grassroots system again is the way for Vietnam to achieve UHC, so that sufficient resources will be kept for sufficient level at the higher level of the care. And then COVID came, And then actually what we found in our region, not only in Vietnam, the COVID severity model, as you know well, that we have to keep the very preciously scarce health resources for the most severe patients who need intensive care. And the next group was about 20% need hospitalization and so on. So we really need a good kind of division of labor by the level of care. So COVID outbreak really kind of re-emphasize the importance of having strong primary health care, so that either the initial like screening or maybe even post-COVID kind of follow-up could be dealt in the community, if not in the isolation center. And as also COVID-19 came in, many patients kind of started changing the behavior to avoid the overcrowding hospital because they are afraid of infection. And government also started encouraging to use more primary health care as your first care of contact. So this really accelerate our support for primary healthcare reform. And in this endeavor, two of our key focal is to strengthen NCD management and the care for all the population. So strengthen NCD at the commune health station is beginning, and similarly to US, but maybe much less extent yet. But already the 77% of the cause of death are due to NCDs, even in Vietnam. And we have an increasing risk factor such as alcohol consumption, tobacco consumption, and unhealthy diet, and so on. So, and then population is rapidly aging. So we have a lots of ongoing risk. And then while the commune health station are quite equipped now to deal with like MCH and communicable disease and general care, they have been being equipped fully to manage NCD routine follow-up after patient getting proper diagnosis, for example, at the higher level hospital, that they are best to be referred back to commune health station. And then we also support like self management and family support for prevention, early detection, and follow-up in the community. And then also commune health station, which is in your community to serve people in a place they live. And then supported by the higher level health system and public health system for any complexity. So this has been already ongoing in all provinces in Vietnam as a part of strengthen primary health care. And since after COVID, all our NCD management training being conducted in conjunction with the kind of COVID-19 refresher. So really trying to get these two areas together, taking a COVID-19 as a kind of opportunity to accelerate this area. Another area we are trying to improve in primary health care is to improve the care for all the population. But a little bit broadly, the WHO support the concept of healthy aging, that is process of developing and maintain the functional ability of the older population that enables their well-being in older age. So functional ability comprised of intrinsic capacity. So this could be like physical and cognitive and all that can decline by age. But it's also greatly either maintained or supported by different environment using assistive devices, for example, even like having barrier-free building and all your environment that you live in your community and so on. That can make a lot of difference. So this, since this year, last year, we've been working on this, what we call WHO guideline on integrated care for all the people, that is really developed for the primary health care and even health and social workers, very customized tool to make a personal plan for different areas of the older population's health, associated with older population's health. And we developed, launched the handbook and also ICOPS in the Vietnamese language. And now we are supporting the government to provide training at district and commune level. And we will later further work on the more age-friendly environment and the community engagement. And again, that is all of these are now also taking place in conjunction with COVID-19 awareness and refresher training. So, and then, yes, thank you, as the chair mentioned about innovation. I think this is happening in many countries, and also like our conference is having on all Zoom. So we are all learning and developing skills for innovation every day with the COVID-19. But yeah, we have had luckily some pre-investment made for example, with one of the university, Haiphong University of Medicine and Pharmacy, to develop the e-learning for health platform prior to COVID. After the COVID came in, we fully utilized this platform to upload all the COVID-related modules translated from WHO Open Up and other original materials developed in Vietnam to provide to not only medical students, but all the healthcare workers, especially at the primary healthcare level who are working in a remote areas so that they can easily come for the training, and also especially in the time of COVID that the travel restriction was there within the between the provinces. So this e-health learning platform was really actively has been used since the COVID-19. And also Dr. Nyung already also mentioned about digital hospital and other IT application. So the government of Vietnam has had this digitalization 4.0 plan, and each sector, including health, has a plan for go digitalize in health. And then during the COVID-19, I understand that many like central hospitals have had used this telehealth network so to treat a very severe patients. So even if these patients who are most experienced may not be in the particular hospital, they could provide guidance to how to treat these most severe patients. And this is like the network between specialists and specialists, or another specialist and doctor with lower level. And then also other networking of the primary healthcare level is beginning, and WHO is also trying to support MOH to facilitate this, especially learning and supportive telehealth network between the district health and commune health station. Again, this is the backbone of our grassroots system. And also in the time of new normal and avoiding physical distance, especially in preparation for possibly wide community transmission, the telemedicine between commune health station and people in the community. So these are the kind of initiative that we are taking the crisis into opportunity to further accelerate application of telehealth, telemedicine. And then just on the last few, so COVID vaccine already, there was some discussion and answers in the chat box. I just also would like to reiterate, as Dr. Nguyen said, this is still in the pipeline, but yes, government has a kind of vaccine deployment plan being drafted, and is still being discussed. And then their first priority is to promote the domestic vaccine production as a probably most sustainable way, and some bilateral discussion ongoing with the government of UK, for example. And then WHO together with UNICEF, of course, supporting their participation in the COVAX facility. So the situation now is around here, that the government is preparing application form. Especially my team is supporting the regulatory preparedness, among other things, because for this kind of emergency deployment, that the regulatory system, especially for marketing authorization, lot release, and then management of adverse event, following immunization, AEFI, and risk communication is particularly important, as also other speakers mentioned, especially with have had pentavalent vaccine AEFI issues in last few years, and there was good vaccine acceptance in general, but there are some fear about certain kinds of vaccines. So AEFI management and risk communication would be quite important. And even not just for the COVID vaccine, because if this is not dealt well, there will be a possible decline of trust on the vaccine should the fall other immunization programs. So I think this will be a very important issue for us to support, in addition to all this, cold chain and the logistic support. So last, I think also WHO works on health, but COVID affects all of our society. So we work with many other UN agencies on to address the broader socioeconomic impact. Just few example, one of thing is, for example, the new initiative working with ILO to support the guideline for healthy workplace. Another area, for example, to work with the UNICEF to improve access to safe and clean water, not only in the communities, but also at the healthcare facilities. And then with IOM, the migrants are sometimes quite vulnerable to be left out with any service access. So we are also working with these migrants and health, especially in the time of COVID, including all those Vietnamese returnees coming back from overseas as they lost job, for example. So there are many areas that we are working as a UN family. Then finally, as just because this this session's title is for sustainable effective strategy, I just want to summarize a few things to support the government dual targets of disease outbreak control and economic development. And then the slogan is a safe coexistence with COVID-19. We really try to support all the public health measures for the government to remain vigilant and taking more risk-based approach. So make a good balance of public health and economy, but also make sure that all the other essential services are not forgotten, especially immunization already reduced some coverage, especially in the month of April, for example, NCD and risk factors and older people, as it will really contribute to the prevention on the to prevent the severe COVID cases. And also this week is the antimicrobial antibiotics awareness week globally. And we also had Dr. New and Dr. Omagali in the WHO AMR related events. I also want to emphasize not to forget the issue of AMR in the time of COVID-19. Then our team will continue to support the building resilient health system and stronger PHC to reduce health inequity and protect vulnerable population. So we are saying in WHO, this is, of course, the government is normalizing the new normal. We also say maybe we can even become better. So using innovation and so on. So not rather than new normal, we try to aim for new better. Then this is our regional directors, the graphic that COVID-19 really gave us the different kind of new viewpoint to that, and health redefines the way we live. So beyond health sector, that the many things are changing the business and society, and instead of going for a more fragmented and conflict world, we will try to go and even using innovation, not just go up slowly, but try to leapfrog to the new normal using innovation and creating the future together. Thank you very much for listening to my presentation. Over to the chair.
Thank you very much for your comprehensive talk about actually positive changes in Vietnam healthcare system during the COVID-19 pandemic. And thank you very much for mentioning not only about the universal health coverage, which is very meaningful to Vietnamese, but also the network to prevent non-communicable diseases such as diabetes and hypertension in Vietnam. And your talk remind me about the previous quote from Dr. Nguyen from the VietMD organization and from the Win Medical Center, that the most meaningful work to reduce the health effects of COVID-19 is actually to control the non-communicable disease, right? Thank you very much. And I would like to welcome a question from the floor. Any question, Dr. Ang?
Yeah, we have a question about on the Facebook on the how the USC yeah, let me read it. How the USC progress now in Vietnam have contributed to the change of the situation of the COVID-19 in Vietnam.
Yes. Okay. Yes. Thank you very much. I think, yeah, as maybe I was too quick to show the graph, but so UHC in terms of the service coverage index, this is the composite index. Vietnam is about 75 over 100. So it's really going well. And compared to other countries with the same economic level, it's actually quite good. And financial protection, as you saw, is quite good. And in addition to health, so for service coverage, as I mentioned, the communicable disease MCH in general is quite good, and they have invested in a very good surveillance system, laboratory capacity. I mean, really taking the lessons since the SARS and the H5N1 and so on. So we are really in good shape thanks to the government leadership. But as we now already emphasized many times that some of the risk factors for COVID patient to become severe is age or is NCDs, pre-existing condition. And that part that I didn't show you the figure, but we have some data from a STEP survey, for example, that about less than half of people who have like high blood pressure or high blood glucose, for example, first go to healthcare. And among this, we call the cascade of loss, right? Then about less than half will be actually treated and then they control. So they, like HIV cascade loss, that we know there's some kind of prevalence, but actual service coverage and then treatment success is still limited. So these are the areas that using the COVID-19 as opportunity, we really have to urgently accelerate. And also financial coverage, government of Vietnam did a very good job in terms of not only supporting like test fee, but providing financial support for the quarantine and the other business sector, the poor population. And then as Professor Chan mentioned, the US, if you are US uninsured, I guess when you are sick, either COVID or non-COVID, you would feel reserved. You would not easily go to seek care, right? And if you don't go to healthcare, nothing will be picked up. So I think in that sense, at least all the government, all the people in Vietnam, most of them have access to healthcare at the initial stage. So this is really the great assurance, and I think that helped. I believe that it helped Vietnam a lot for prevention of initial the fight against COVID-19. I hope I answered your question.
Yes, thank you very much. And I'm very happy to hear the voice from WHO Vietnam, right? And your talk really brilliant about the problem that Vietnamese community need to deal with in the near future. Actually, I have a question about the fees in terms of the cost effectiveness, because many patients told me that the healthcare payment is very cheap in Vietnam. So, but we need to spend many treatment of severe diseases such as cancer. And how it's going to be, because in the future, we need to spend money for preventive work, such as how to have people do more exercise and change their lifestyle. Do you think that the coverage will also take care of that part?
Okay, Professor Quiz, that's very relevant question. So actually, while I praise the 95% coverage of health insurance fund in Vietnam, we have a bit of issue since the last 2 years. Vietnam health insurance fund in red. That means more expenditure than revenue. And then, of course, there's some saving and difference among provinces. So overall, it's still running. But as we analyze the expenditure, that of course the people's health-seeking behavior has increased, and they want to have more of health. The health expenditure per capita from 2000 to 2017 increased 3 times fold. So it's about more than $200. But the thing is that there are probably unnecessary or overuse of medicine. It's really related to our AMR because more than half of expenditure is medicine, and the amount that is the majority, quite a big significant number, more than 1/3 is antibiotics. And then Vietnam is one of the countries which is showing the quite increasing AMR resistant to some of the key, broad spectrum antibiotics, for example. So we think we don't want to discourage people's behavior because we want to have people have good access, but we don't need for the system to give unnecessary treatment, unnecessary diagnosis, unnecessary medication, especially which may especially lead to AMR. So there needs to be big balance. And I guess using both data really plays role because now Vietnam health insurance have all electronic claim review system, following the system in like Japan and Korea. And also patient record is becoming digitalized, as Dr. Nguyen said. So with this data, it would be much better to analyze what is the rational prescription, and then also educating the both. Not only the doctors or healthcare providers have fault, because it's the patient side who ask for more medicine, especially antibiotics. So we need education and movement at both ends that really actually happened this week. But yeah, that is, I think, will be issues that Vietnam will face because of also other new technology and the therapeutics coming in. And I guess we can really learn from other countries like maybe Japan and so on, which manage, high quality care with some good price control. Yeah.
Thank you very much. So maybe the last question for your talk from Dr. Ang. After the COVID-19, how the burden of NCD, is that increasing? And do you think that local health facilities can face or take over this kind of new flow from the community?
Okay, thank you. I think it's very difficult to decrease burden of NCD. Like we already have a double, triple burden. I think communicable disease burden could decrease because of the good control system, and then public health efforts is quite strong. But the NCD is really linked to the lifestyle, and as we all developed countries has gone through, you have to reach certain point that the people really become health conscious and change the lifestyle. But Vietnam, I think, is still in the middle of the stage that people enjoy more access to good food, and then staying away from traditional lifestyle. And then we are especially supporting a reduction of excessive intake of alcohol, tobacco. Still, maybe we decrease a little bit. Salt reduction is still quite high, and then physical inactivity is unfortunately increasing. So I think these risk factors and behavior would lead to the biomedical symptom of high blood pressure and high blood glucose and so on. So this will be a problem always come with the development. But again, we are trying to prevent for introducing not only the health promotion behavior, but very early detection. And then early detection and intervention is much cost effective. And then, of course, the less burden for people at the primary healthcare level. So even without waiting for the people to become old, that the introducing education from the school for time, for example, and having already many communes are doing kind of regular mass screening of people. So before they become a very later stage of NCD, we try to find it and then also screen and have a intervention so people can manage it with least kind of invasive intervention. So I think this will continue to be a problem, but it's I think great that people's awareness could be raised, especially with COVID-19 as a trigger. Thank you so
Thank you
much.
very much.
Yeah.
So as all of us know, the positive aspect of COVID-19 is make people recognize more about the NDC. And also you can see on the newspaper that more and more people now aware about the effect of environment pollution.